Hi, I'm Danny Aronson, CEO and co-founder of Tuned, and I am joined here by two wonderful colleagues of mine who will introduce themselves in a moment. And we are going to have a discussion about the importance of music audiology and the innovative and important role and leadership role that MusiCares is taking within this important aspect of hearing care. And without further ado, Heather, if you'd like to introduce yourself, and then Stefanie, that'd be awesome.
Sure. I'm Heather Malyuk. I'm a doctor of audiology. I serve as head of audiology for Tuned. I also head up the audiology side of our MusiCares partnership, as I have been a music audiologist for a little over a decade. And Stefanie?
Sure. Hi, yeah, I'm Stefanie Curtiss. I am the managing director of health services with MusiCares. So I've been here almost 9 years. My background is a master's of clinical psychology, but I'm able to kind of use that background to support the music community nationwide when it comes to all elements of physical health and wellness. So I'm very excited to discuss the partnership that MusiCares has with Tuned today.
Awesome. Thank you for being here with us. I want to dive in with some thoughts and questions with you. And just to start, I'm curious what your opinion is in terms of the awareness of and attitude toward hearing health among musicians and industry professionals. Of course, my viewpoint is biased, being a music audiologist for 10 years. What's it like from your side? What are you seeing?
Sure, absolutely. I think a couple different things. I think there's a small pocket, I think, of industry professionals, usually like the audio engineers, producers who 100% understand the importance and value of hearing wellness. And so I think that a lot of times we interact with those community folks really excited about the protection that MusiCares could potentially provide. Then we have our older community who have been in the industry for years and unfortunately maybe did or didn't know that there were resources and options available, but are now finding themselves needing some help with perhaps hearing aid or some tinnitus treatment. And then I think the larger part of what we really see is sort of a nose to the grindstone, kind of just wanting to ignore the fact that that's an issue. I mean, everyone knows that it's an issue. Everyone knows that they're constantly exposed to damaging loud sounds. But I think there is a bit of an idea of like, well, what can I do about it? And I'm not going to stop working. So just keep pushing through. And so that's where I think the largest probably piece of what we see in the MusiCares role is that kind of aware that it's there, but not aware that there's necessarily resources and support that they could tap into.
Yeah. It's sort of amazing how many individuals don't fully understand how to access hearing health, even outside of the music community, but definitely within the music industry. And of course, hearing health options are not new to MusiCares. That's been on the table for a long time. Of course, it's quite different now, but before you discovered Tuned and sort of the full scope of hearing wellness, how did you view the hearing offering prior to this?
Yeah. So our primary hearing effort, although we did have some educational workshops and things partnering with various audiologists across the country, but our primary effort prior to our partnership with Tuned was being on site at various festivals across the country, where we were partnering to provide molding on site, where then individuals would get those custom musicians plugs in the mail 4 to 6 weeks. We were really excited about that. There is a lot of benefit in some ways to that. However, I think what we learned as we started doing that was that our intention was thinking that we would be out there like educating and raising awareness. But I think just inherently that system of a festival where everyone's working or there to attend, it really kind of ended up turning into more of a distributing the product. And we weren't getting that education and awareness piece that we were wanting to be able to provide. So it's one of those opportunities where there's still some benefit. Definitely people do know that MusiCares exists in some ways, and those who have those plugs and are using them are getting that protection. But we definitely realized that it wasn't the it wasn't the ideal situation for us because we really wanted to do more than just provide that product. We really wanted the opportunity to be able to focus on the education piece as well.
Absolutely.
I think Stefanie touched on a pet peeve of yours here, Heather. And maybe we can spend like a minute or two talking about custom versus universal earplugs, because I think there's a misconception here that is important for people to learn about.
Yeah, I think, well, it's very interesting because when you look at the marketing for products, of course, when something's called a musician's earplug, it's the holy grail, right? And so many musicians are told musicians' earplugs will make everything softer, but it'll sound the same. And I can speak as a former pro musician who had a pair before I became an audiologist. And I remember going to see the audiologist and was told, you know, these will sound the same. There is an ear training component with any earplug. And so many people, if they're not appropriately fit for their custom earplugs, maybe not putting them in properly or things like that, I've had some people find that they actually get a better sound quality and fit with universal fit. So this is where it's so essential the audiologist comes into play. And even like you said, Stefanie, people who have the custom earplugs, seeing them now for educational appointments, and they'll verify that they're putting them in the right way. They'll ask about different types of frequency responses of earplugs. And one of the things I always discuss is the research on custom earplugs and universal fit earplugs and how much variability there actually is with both kinds. In terms of the spec of the frequency response. And, you know, the people that really get into it, like you mentioned earlier, are the audio engineers. And they love to see the graphs that we show in the appointments and discuss the research. But yeah, there's so much more to it than just earplugs, than just getting the earplugs.
I was in my background, as you know, for like 20 years, I ran a large post-production sound studio in Israel, and I had 15 employees doing sound design 12, 14 hours a day. And I have to admit, it never crossed my mind that they should see or talk to an audiologist once a year. It was not something that I even considered, didn't think about. And I think one of the things that is really unique about what MusiCares is doing is really putting the audiologist and the opportunity to talk to a hearing care specialist like an audiologist on a regular annual basis front and center. So it's not about the devices. It's not about whether you need hearing aids or this or that, or it's about creating a baseline and sitting in front of somebody like Heather or Laura or anybody. You know, we have this incredible group of music audiologists, and somebody actually taking the time to talk to you for a second and understanding what your work life is, what are your challenges, what can we do? And I think a huge part, and we're seeing it in the type of surveys that we're doing, is that people are very, very interested in prevention. Severe hearing loss is not a necessary outcome of your professional life. There's stuff that we can do. And I think that MusiCares positioning itself at the forefront of this is honestly outstanding. And again, we see it from the feedback we're getting from people going through the program. This is a lot of the value that they're getting out of it.
Yeah. And one of the things that I really love about MusiCares, and I've admired for quite some time, is I think so often music industry professionals are viewed only as that. They're a music industry professional, and MusiCares views them as people. There's much more to them than that identity and the way they care for them. And Stefanie, I'm curious what you have learned or what you think of or have been surprised by how hearing health is really linked to mental health and other things like diabetes, individuals who have tinnitus and need support there, and you know, the connections you're seeing with bringing in more of that care aspect of hearing health and how it really applies to the whole person, not just that music industry identity. What are you finding there?
Yeah, absolutely. And something that MusiCares has always done, but really wants to continue to push forward, is look at that holistic approach of the individual. You know, we talk all the time about, you know, we have our 3 teams within MusiCares where we kind of have those area of focus, whether it's the human basic living needs, the mental health and addiction, or the health services, which is where we're talking today. But you really can't separate them. You know, if someone breaks their ankle and can't work, well, of course, that's going to affect their basic living needs. And if you're not able to get out and about, or you're not able to work, that's going to affect your mental health. So 100%. And I think when it comes to hearing, we see the exact same thing. I think for me, the thing that really resonates the most, I've seen it in my own life with my mother and my father-in-law, is really the mental health component with hearing loss. There's such an isolation to that, whether they physically isolate, which I've seen and heard from some of our clients, or if they're actually around, but they're just kind of nodding. They're not really actually fully understanding what's going on. And I think within the music community, there's probably even an amplified amount of that, because there's a fear and an anxiety behind everything that they don't want to even acknowledge. I think there's a level of shame that I hope we can take off the plate with this initiative. But I think that's really universal. But I think you add that shame with that anxiety or fear of the job going to the next person, I think really contributes to some potentially severe mental health concerns that are directly correlated with the hearing health of the music community.
Yeah. And I know you really hit it right on the head. And we have some of our providers are so wonderful on the therapy side. And I know I've referred some of the patients I've seen to other providers to really work with disorder management, looking at that sort of mental health component and how important it is. And we keep talking about the music community, music industry. And I think many people who see this might think, well, this is just for musicians, right? But of course, MusiCares has made the access to tuned available to all members. And I guess I would like to hear it from you why this is important for other people in the industry who are working like stagehands, tour managers, et cetera, and not just the folks who have the instruments in their hands on stage.
Sure. Yeah. I mean, it's a great question. I think in general, and I know we've discussed it as a team, it's like, when I was in school, I got my hearing screen at school. And then even though I go for my annual physical or whatever, it's just not brought up anymore. So I think just as a general rule, it's a gap in our healthcare system, and it's a need that everyone has. And then you add in the fact that those within the industry, whether you're a photographer or security who's right next to the stage, or to your point, some of those other individuals who maybe their job themselves may not be directly, they're still having that extended exposure, and I know I'm preaching to the choir as the audiologist, but it really is about the amount of time that you're exposed to the damaging. So of course, anyone in the industry, no matter what the role is, even if it's just when you're attending, we want to make sure that you have an understanding of what the damage can be, what are the safe amounts of time and levels and all of that. And then of course, if needed, additionally, some protective, products to be able to support that too, because it really is, to circle back to the previous conversation, the more we can be preventative, the more we can be education. It's not just going to positively benefit them, but their families, their friends, their communities as well. And I think we all want to cause, I always talk in ripples and positive effects, but we just want to feel and send out as many positive ripples and make the biggest, most thorough impact on the music community and the whole community as we can with this effort.
Yeah, I agree. It's going to be really cool to see what happens, 10 years down the line, how hearing health has changed because of the efforts that we're doing together. When you started looking at doing something more for hearing health, so put yourself back in the mindset before you met us, what were you looking for?
Yeah. So we wanted to find a partner who was knowledgeable of the music industry and the uniqueness. We had received feedback from a lot of our clients that had seen audiologists that were very knowledgeable medical practitioners, but they didn't understand the uniqueness, and a lot of the recommendations may be contradictory to what individuals in the music industry could really, commit to. So we wanted to find a partner that really understood our community. And so with you, Heather, and I can't say enough about the providers that we partner with Tuned. The variable expertise, the years of expertise, and the specific targeted knowledge of the music audiologist with Tuned are just like irreplaceable. And so as soon as we knew that there was an opportunity to partner with an organization that had all of that knowledge, passion, we knew we wanted to explore it. And then as I got to know Heather and Danny and the organization, we saw that our mission was aligned and that education is first. We really, really feel like that education, knowledge is power. And so, to get to partner with an organization that is as passionate and as focused on that education piece as MusiCares was so exciting. And then I think logistically speaking, the fact that Tuned was virtual, we struggle so much of the time with our community trying to get people in an office somewhere, unless it's an urgent, like something bad has happened and we want people to be able to connect ahead of time. So the fact that it's purely virtual, you can do the screenings on the road, whenever is convenient to you, as well as the actual appointments. The flexibility there was just really kind of a no-brainer when we found out that was going to be an option, because we knew that was going to remove a huge barrier from getting this delivered to our community.
Yeah, I think that's always been a struggle of the music industry, is having a relationship with a provider that is ongoing and not having to have someone new in every city, where Tuned makes it all very, very convenient. And I really appreciate what you said about the education side and the providers we have. I'm really proud of our team. And I think for anybody listening who doesn't understand audiology has specialties, and music audiology is quite rare. And there truly are a limited number of us. And I think what makes us so nice for this community is all of us have the mindset of educating the music industry professional to allow them to own their own hearing. We don't own it. We educate them how to go out and have every tool they need, that no matter what scenario they are in, what venue, what state, what country, they have all the tools to stop and say, okay, here's what I learned. Here's how I'm going to protect myself in this situation. Or here's what I learned. Here's how I'm going to manage my hearing disorder today. And I do see that from our whole group of audiologists, that's really what we're about. Is that ownership of hearing and really giving the patient everything they need. I think you sort of already answered the next question I was going to ask, which is why you chose Tuned. But you sort of, already said it's because of who you had access to and how easy things are. I remember when I first started dabbling in telehealth many moons ago, because I had patients on the road, I was doing things like trying to talk to them over the phone or using Skype or this and that. And I was always not doing a lot with it because it wasn't always compliant in certain ways. I didn't want to put anyone's privacy at risk, this and that. Where Tuned has created a truly 100% virtual clinic that is compliant in all ways. There's no privacy issues. There's no care issues. We're very careful about, licensures and different things. And so I think I'm just saying from the audiology standpoint, the music audiologist side, it's the same as what you said. It's making everything very, very easy for all of us to connect with each other, which Danny, I don't think I've ever mentioned that to you, but that's been one of the really cool things for me, is that I feel very secure on the platform.
I think I think it's certainly something that we take a lot of, care and put a lot of time and investment in. One of the things that I kind of, when Stefanie and you and I kind of started talking about this, I think it was like mid 2022, and we had this vision of what this could be. And I think Stefanie was very inspiring in the sense that she was like, I want people to understand that hearing care is more than just hearing protection. They need to talk to audiologists, positioning the audiologist, being very careful about the type of audiologist that we put on the platform and their kind of experience. And the payoffs, and this is kind of looking at data that we're seeing, which to my mind is like mind-blowing. So the average age of people going through the Tuned platform is between 28 and 42. These are people, honestly, that without MusiCares and Tuned would probably not have seen an audiologist for decades. This isn't years, this is decades. Another thing that I found honestly really incredible is that we've had a lot of patients who found great value in it, but we've had like more extreme cases where the patient had seen an ENT or seen another audiologist, and basically what they were told is there's nothing we can do. Mm-hmm. And these are people I know, because these are my people. I spent my entire professional life as a sound designer and musician. I think it comes through and all three of us, how deeply we care about this community, because they are our people. And then they go to somebody like Heather or Frank or Laura or somebody like this, and they're like, no, there's hope. I know this, I've seen this before, I can do this. And they go back to MusiCares and they get a grant and it's funded. And there's like, and it's not like there's one option. There's like 3 different options you can choose from, and maybe this and maybe, and you see the reaction of people. They had no idea that any of this existed in the market. And I think making it possible for them to engage through MusiCare's support and awareness and everything that you guys do, but also through the very specific expertise and empathy that I think a lot of the tuned music audiologists bring to the table, I think has been like, we have like specific stories. People have been told, no, you got to leave the profession. 6 months later, they're back at work. Like, this is a life-changing thing. So I think that in that case, just from when we were like envisioning this and talking about this, like July, August of last year, we were like, oh, it would be great if, and this is what we're seeing. We're seeing much younger people. We're seeing people talk about protection. We're seeing a lot of options. So I am incredibly proud of the work that's been done.
And just to go along with that, you know, from our perspective, we internally say all the time that we feel like you guys are an extension of MusiCares. I mean, it really does feel like one team. The communication and the collaboration is just so effortless because we are so guided by that same, drive. And so I really, truly feel, you know, in a way that's beyond any other provider MusiCares has, that when an individual gets connected with one of the music audiologists at Tuned, if they identify another need, they know that they can send them back to MusiCares. It's even if it's completely outside of audiology, if it has to do with a rent need or a substance abuse need, you know, we've really partnered well together to ensure that when someone comes into the fold, we make sure that we're supporting them from that holistic mindset. And it's just been so wonderful to see some of those additional silver linings as well, that MusiCares is being able to follow up and provide some additional services outside of even hearing, just because of the amazing partnership that we have with you guys.
Yeah.
Totally. I want to ask Heather for a second question. So you've been doing this for a long time, and we've been doing this with MusiCares, I think, since October. So we have some. What is what are like the seminal things that you're seeing? What have you learned, or doing this over the past, I don't know, 4-6 months now with the MusiCares population?
I think a couple big things stand out. One of which is how hungry this population is for good evidence-based education and information. I think that there is a lot of confusion on the internet, particularly around the use of things like in-ear monitors, for example. So many patients I'm seeing use in-ear monitors and have never been taught how to use them safely, how to take sound level measurements, things like that. I think it's really exciting for people who make appointments to get a full hearing screening. But I think where I'm seeing the meat and potatoes is all the information they get. You know, Danny, you brought up people thinking that they have to quit and then they don't. And I just had a situation like that, and MusiCares was able to help this person. And it just, I mean, the appointment ended in tears. It was really amazing to see this. So those are some themes. One of the things, though, that I think anyone listening to this should realize, we do have individuals who have disorders who need help, who get it. But I would say the majority of the patients are actually people who are doing very well and who need education about prevention. So we're seeing both. I just want to make that clear. So many people I see say, I don't want to get tinnitus, which is ringing in the ears, like someone I knew 10 years ago. I'm really afraid that I'm going to get pain from sound. I'm terrified of losing my hearing. I know my hearing is fine now, but I don't want to need hearing aids when I'm older. And learning about even other causes of hearing loss, not music related, learning how to really care for themselves as people, that's been the big takeaway, is that educational component.
And I think to even go beyond that, I know I'm hearing that getting that baseline screening, because there's the anxiety of and fear of that happening, but then to know that they have with this provider that they can go back to at a later date, if heaven forbid they think that something has changed, and actually be able to compare it and see, is just unbelievable too.
Yeah, I agree.
That's awesome. So just to conclude, this is going out on World Hearing Day, which is March 3rd. I think it's a wonderful opportunity to raise awareness for the importance of hearing care. Tune's mission is to make hearing care as ubiquitous and as affordable and as available as dental and vision and any other health-related issue, especially if you're working in the entertainment industry, obviously, especially if you're a musician. Your ears are your most important instrument. It's as simple as that. And I think thanks to MusiCares' generosity and the system they've put in place, and thanks to the incredible music audiology team that Heather has put in place at Tuned, you now have a place where you can go and really get the care that you need. And I urge everyone and anyone who can to take advantage of it. I look forward for a continuing wonderful relationship with MusiCares. As you said, these are our people, and we love taking care of them as best as we can, and we love working with you. So thank you very much, Stefanie. Thanks, Heather.
Thank you.
And
Thank
happy
you so
World
much,
Hearing
Katie.
Day.
Happy World Hearing Day.